You may be surprised to learn that a lot of the ingredients you're using in your skincare products actually do not belong together. So let's start with the morning routine, your vitamin C or your niacinamide. These are oftentimes used in the morning. However, I don't know if you know, but vitamin C and niacinamide can both actually irritate the skin. How does that work? You know, vitamin C is an antioxidant and it generally can brighten the skin, but at higher concentrations, and in certain people with very sensitive skin, you can actually get irritation. Same exact thing with niacinamide, which is an active ingredient that's known to calm the skin. Surprisingly, in some people, it actually causes redness, and it's incorporated with some sunscreens, which also makes it confusing because sunscreens, when you go out in the sun, oftentimes you attribute redness or irritation to the fact that you were out in the sun for too long. But I've seen many cases where this is actually due to the niacinamide that's actually in the sunscreen itself. Now, nighttime, some of the ingredients that people use most commonly are benzoyl peroxide, whether in the form of a wash or a cream, retinols, which are people use for anti-aging and exfoliation, and even hydroquinone. Hydroquinone is an ingredient that is used to treat pigmentary conditions like melasma, overall hyperpigmentation from inflammation, or really any other trauma to the skin. And so these things are oftentimes used together, and the instructions that you're given are use this at night before bed. So people use hydroquinone with benzoyl peroxide with retinol. And what happens? People get extremely dry, itchy, flaky skin. A lot of these things can be combined because they're too irritating when used together. Two exfoliants or an irritant and exfoliant, these things when used together in sensitive skin will cause major issues over time. But it may not happen immediately. It may actually take a week or two for that to actually happen. And so just be careful and document when you do start using products. I suggest using products and introducing them every 3 weeks rather than doing it every week when the fulminant reactions have not yet happened. Another thing that can happen, especially with benzoyl peroxide can oxidize many things. This is how it works. This is how it kills bacteria. However, a lot of what you're using in your skin are antioxidants. So your oxidizer will actually neutralize your antioxidant. So when you use a benzoyl peroxide along with an antioxidant, say nighttime cream or day cream, it can make them inactive and not effective at all. Benzoyl peroxide can also deactivate a lot of medications as well topically. And so just be careful and make sure when you do use medications, you do let that dermatologist or your doctor know that you're using benzoyl peroxide in a wash or in another form. That way they can guide you as to how best to apply them, in what order and what time of the day. So you can split up certain products in the morning that don't neutralize each other or don't overly irritate, and you can do another set at night. So skincare routine gets more complex as you build in some active ingredients, and it's important to know that not everything can be applied to the skin together. Even though they may feel fine, you may be deactivating one of the active ingredients that you actually want to work. Hope this is helpful.